Thank you, Casey, and good morning, everybody. Thanks for joining us. I just want to start with an update. If you've looked at the numbers, you'll know that our long-term care outbreak numbers look different than they have in the past, and there's a reason for that. As of January 18th, we changed how we define COVID outbreaks at our long-term care facilities, and that's reflected in our latest respiratory disease watch webpage. The change in the outbreak definition does not impact case numbers. Say that again, doesn't impact case numbers. However, the new definition, it takes more cases to be considered an outbreak. So here's what changed. Based on federal guidance, the definition of an outbreak in long-term care is 2 or more cases of COVID-19 among residents, or 1 or more cases of residents plus 2 or more cases of staff. And that's all written down in our on our website. So previously it was 1 case in residents and 3 or more in staff or residents. So that's just a little bit of a change. It makes it a little bit easier for the long-term care as far as reporting, but it doesn't change anything that they do internally when they have cases, and it doesn't change anything we do to support them if they have an outbreak or if they have questions about how to manage COVID. So the immediate change you're going to see is that we went from 53 last week to 26, but that 26 represents could represent even more people. So I want to caution you against comparing the data from previous weeks to weeks going forward, because you really just can't do that. You're comparing oranges to apples, and that doesn't work very well. Again, doesn't mean that COVID cases haven't dropped. We're making this change to stay in alignment with the new outbreak definitions established by the Council of Outbreak Response Healthcare Associated Infection and the Council of State and Territorial Epidemiologists. This updated guidance was based on, they updated this guidance based on the evolving COVID situation. We're in a different place with COVID than we used to be, and conditions among facilities, local communities, and other considerations. It was left up to the states whether you would adopt this new definition, and we as a state decided to adopt this new definition to stay in line with our federal partners. And as you can see from the data, there is some encouraging news. Our influenza-like illness visits to hospitals and doctors' offices have gone down. And we're seeing, our data continues to trend down. We certainly could see another spike that's happened if you, again, look at the historic data, and we do sometimes have spikes after we go down for a little while, we'll go back up. But one thing I do want to bring up that our hospital partners have noticed is that they've seen an increase in the number of patients. And they're seeing their hospital capacity, their bed occupancy has gone up over the last couple of weeks. COVID hospitalizations, however, haven't really increased significantly over the last 2 weeks. So this could be driven by flu or even other illnesses. We don't have that specific data, but I want to just take this opportunity to remind everybody of a couple of things. One is, consider seeking care sooner rather than waiting until you're so sick you have to go to the hospital or go to the ER. So if you get sick and you just feel like you need to be seen, go ahead and get seen by your primary care doctor or at a walk-in clinic before you get so sick you have to go to the ER. And also, just to reinforce the fact that getting your COVID vaccine and your flu vaccine can reduce how sick you get if you do get either COVID or the flu, and decrease the chance that you're going to have to go to the hospital. So those are all really important things for all of us to think about, that vaccinations can reduce our risk. And if we seek care sooner, we might not end up having to be in the hospital. We might be able to get treated and stay at home. And also to remind us that the simple preventive measures like washing our hands, staying home when we're sick, and covering our cough can also help reduce disease. And I think it serves as a really good reminder for all of us to be really thoughtful about when we visit those in our lives who are more likely to have a complication if they got sick, regardless if it's the flu or a stomach bug. Our elderly, those who with underlying medical conditions, the very young, and pregnant women are at risk of complications from some illnesses that the rest of us may not experience. And so be thoughtful about if you're sick, don't just stay home from work. Reconsider whether you visit grandma, maybe put it off and visit her when you're feeling better so you don't accidentally make her sick too. So those are my comments. I'm happy to take questions if you have any.
All right, if anyone has a question, if you'll please just raise your virtual hand and I'll call on you in the order that you do. All right, Tom, it looks like you're first.
Hey, good morning.
Good morning.
So I understand the change in the COVID reporting numbers. Has there been any thought to just actually reporting how many cases as opposed to just outbreaks? It would certainly simplify, the understanding for people in the public about what's going on. And I guess.
Go ahead.
Well, go ahead.
Sorry. No, go ahead.
Well, the second question was just, it looks like the COVID hospitalizations went up January 6th, then went down a little bit January 13th. So can you clarify what you meant about hospitalizations?
Sure. So first of all, what we, when we look at COVID reporting, one of the challenges as COVID has transitioned into an endemic disease is that several things have happened. One is people can test at home, so we don't get that information. Two is that a lot of times providers aren't going to test, they're just going to decide that it's COVID based on the situation. And so we moved away from tracking specific cases to really just looking at outbreaks and hospitalizations and other factors that help us just have an idea of what the burden of disease in our community is. And that's just a transition that we're going through across the country in public health as we move into looking at COVID as an endemic illness in our community, in the country. And so that's just a transition. So counting individual cases doesn't help people make any better decision about what they need to do for their own health. The message remains the same, that people should be vaccinated. They need to stay home if they're sick. They need to wash their hands. They need to cover their coughs. And counting individual cases doesn't help people make decisions about what they need to do. And that's really part of our goal. It's keeping track of disease and what's the burden of disease. The burden of disease is going down slowly, we hope. And people still, though, need to be vigilant and do all of those things that I mentioned. As far as the hospital data, I'd have to go back and look at that again. I apologize. The data I quoted you was from our COVID office, that hospitalizations had not increased significantly from COVID in the prior weeks. So I honestly would have to go back and look at that data, Tom. I apologize.
That's right. Thank you.
Tom, do you have an additional question?
Well, I mean, one of the things we're looking at isn't directly related to this, but it has to do with multi-pathogen panels being used to track an outbreak at USC 2 years ago. One of the nice things about it was they could track viruses they didn't normally look at because they had the ability to do that, to test for adenovirus, for instance. And I'm curious if there's been any thought about doing a broader panel, because obviously people are going to be sick from viruses and other pathogens that you're not picking up on your test right now.
So we, public health, don't really do a lot of that broad panel testing in these facilities. And I'm sure that hospitals and doctors and nursing homes are using those broad panel tests that are widely available commercially. But those diseases are not reportable to public health. So we only track those things that are on the list of reportable conditions. And there are many things that make people sick that are not on that list. And so we don't track those numbers. So like adenovirus, we would not be tracking that. They probably are using it internally for their own decision making, but we don't track that.